get started with our presser today, and I'm going to start out, Annette Rodriguez, I'm the Director of the Health Department, and I'm going to start out with the Nueces County daily COVID-19 statistics. And so if you look at the first slide, you're going to see over the last 2 weeks, you're going to see the daily cases. And I think what's the most important from this is if you look at these numbers below 100. So you're seeing 61, 9, and 88 cases. So the numbers are definitely coming down. That's a really good trend, and that's very exciting to us. Again, this is not the first time we've seen this happen. This is actually our third wave, and we're coming down on the other side. Next slide. These are actually the total cases for Nueces County since the very beginning, March of last year. And so it's a total of 64,274 cases in Nueces County of people that have had COVID-19. So 59,823 people are fully recovered, but we do have a lot of active cases right now at over 3,302 active cases, which means people that actually have COVID-19 are still in that period where they can transmit that virus to other people. And we've had over 1,149 deaths. On this slide here, you're going to see the hospitalizations, and so you're going to go back 2 weeks and you're going to see a 324, but you notice the trend that the hospitalization numbers are coming down. They dipped down yesterday to 215 people hospitalized with COVID-19, and they kind of took a little upswing today at 228. So I want you to remember this slide because I'm going to talk about it later, because when we were at our peak this particular wave, we were closer to 400, and now we're lower at 200, but that's not the best place to be if we're getting ready to go into the winter peak. So next slide. So these are the ICU patients with COVID-19, and they've been at around 100 since we started this peak, and now they've dropped into the 80s, which is better, but they were at 90s for quite some time as well, and so we're still seeing, like today, at 84 patients that are in the ICU struggling, trying to fight against this COVID-19 virus. The next slide shows the total number of deaths, 1,149. Today we reported out 9 deaths here just in one day in Nueces County, and my deepest condolences to the families of those individuals. I can't imagine losing a loved one to COVID-19. So again, my condolences to the family and friends of the 9 individuals that were lost today. And this slide shows the fatalities over the last 2 weeks. And I think it's very obvious here that last week you see 4, 8, 4, 2, 7, 4, and 6, which is a total of 35 fatalities last week. But this week we've had 41 fatalities. So the fatalities, everybody has heard, first you get infected, then you might end up in the hospital a week or 2 later, then you might end up in the ICU, and then you may end up dying from this disease, and you're seeing the lag. So you see 41 for this past week, 41 deaths in Nueces County. So we're seeing that lag now. I'm going to turn now over to what we've been doing at the Health Department, and so some of the things that we're looking at. So as we enter the 19th month of the pandemic, there seems to be no stopping the COVID-19 virus, which continues to wreak havoc across the world. The United States death toll from COVID-19 has surpassed that of the 1918 Spanish flu, making this the worst pandemic in our country's history. The fast approaching season of sniffles and coughs looms ahead, and it seems like that the hospitals and public health authorities will be stretched again this coming winter with pediatric cases and their well-being in the front line. 33% of COVID cases that have been reported since the beginning of the month have been in children between the ages of 0 and 18 years of age. Though the rate of children hospitalization remains low compared to adults, CDC surveillance data showed tallies of new hospital admissions of children under 18 years of age have more than doubled since the previous peak in January. We have also seen hospital admissions and cases leveling off among adults. So remember that graph that I showed you where it went from 400 and it's down to 228 hospitalizations, but they're still very high. So if you have hospitalizations at 200 and then you go into another peak, your cases are going to go up very quickly in the hospital. So it's hard to imagine what is yet to come for us. So why I say all of that is because I want to say, let's be ready. Let's prepare, and let's not let our guard down. Our goal is to bring the next wave, our winter peak, down, and with planning and preparing, this can be done together. Last winter, our peak was over 5,000 cases. This winter, our goal is to keep it below 1,000 cases. We, as a community, have gone through this before and have learned how to bring these spikes down. Ultimately, it all boils down to following the public health precautions, the social distancing, the practicing respiratory and good hand hygiene measures, staying home if you're sick, and of course, getting vaccinated. Most importantly, everyone, vaccinated or unvaccinated, do not leave home without wearing masks or face masks, especially if you're going to be around people that are not from within your own household. There has got to be a groundswell of community spirit to understand, while it is an individual decision on whether to get vaccinated or not, those individual decisions should not impact others, including your loved ones. The only way that can happen is by wearing a mask, like the rest of us are doing, to protect each other. If I've learned anything this past 19 months, is that we all need each other to enjoy life's pleasures. We never want to see anyone dying in the hospital, especially if they're dying to a virus that could have been avoided. This realization will be even stronger if we start losing our children to COVID-19. But let's not find out firsthand. Let's do what we need to do now to protect them. Our children under the age of 12 have no protection from this virus, but they have all of us. We will do everything in our power to keep them safe by wearing our mask around them, and some will even choose to get vaccinated to protect them. Please remember who we are. We are good people. We want our community safe. We want our lives back. This pandemic continues to take a toll on everybody. If this was a hurricane, we would all be helping each other to stay safe. Let's find that same sense of helpfulness that we all have in our hearts and help each other, especially in helping to protect our children. As of Wednesday, 59% of Texans 12 and older are fully vaccinated in Texas, 59%. Here in Nueces County, we are at 58% of that same population, and 75% of those ages 65 and older are fully vaccinated. We are getting there, but we must continue to ask the questions that are holding us back from getting vaccinated and figure out where we want to be when it comes to protecting our children. We do expect to see our percentage vaccinated increase as more children become eligible to receive the vaccine. We're hearing that this is very likely by as early as Halloween for those children ages 5 to 11. This past Friday, the FDA advisory panel overwhelmingly voted in favor of COVID-19 Pfizer boosters. These are for people 65 years and older, as well as those at high risk of severe illness. People at high risk of exposure at work, such as healthcare workers and teachers, will also likely be eligible for a booster dose. These booster shots should be given at least 6 months after the second dose for these individuals. The booster discussions will now go to the Advisory Committee on Immunization Practices, the ACIP, which will take up the issue in a 2-day meeting starting today. So we're hoping to hear something tomorrow. Just a reminder, this booster approval is only for Pfizer booster. So if you're coming in, once it gets approved and you say you want the Moderna booster, and we say that's not been approved yet, be patient, because it is coming. It's just not at this time. So we will start giving out these Pfizer boosters as soon as CDC approves and the Department of State Health Services gives us the green light to start. So we're hoping as early as this Friday. So I have a chart up here that actually shows you if you had your second Pfizer or Moderna, your mRNA vaccine in any of those months, January through August, these are when you would be eligible to receive your booster, okay? So July, August, September, October, November, December, January, February. So if you had your second Pfizer in April of 2021, you would be eligible to get your booster in October of 2021, or of course later. It just says at least 6 months. It can be 7 or 8 months, but at least 6 months. Okay, so hopefully everybody understands it's for the Pfizer booster, and hopefully that'll be at the end of this week. So the next slide, we're going to show the statistics that we normally show you on the vaccinated versus the unvaccinated. So a lot of people have been requesting this. And so what you see here is for COVID cases from July 1st through September 20th, you have 17,338 individuals that were not vaccinated that actually got COVID. And then you have 812 people that were fully vaccinated that got COVID. So it just shows the difference between being unvaccinated and being vaccinated, how much less people are getting COVID-19 once they've been vaccinated. Next slide. This actually shows the hospitalizations from August 1st through September 20th, and it shows that almost 799, which is almost 800 unvaccinated individuals were hospitalized versus 100 that were vaccinated that ended up in the hospital. So I think these pictures speak for themselves, but I think they're important to remind people that you really, getting vaccinated really helps to keep you from getting COVID-19, the virus, and also keeps you out of the hospital. So a reminder that flu season begins October 1st and will run through May 2022. The flu activity was unusually low throughout 2020-2021 flu season in the United States. Last year, 2019 through 2020. Despite high levels of testing, there were still very few people that got flu last year, which was really the silver lining in all of this. The COVID-19 mitigation measures, such as wearing your face mask, staying home, and hand washing, likely contributed to the decline of the flu incidents, hospitalizations, and deaths. Our goal again is to keep these numbers down and beat this next wave of infections like I mentioned earlier. We want to encourage the community to also go out and get your flu vaccine. CDC recommends that everyone 6 months of age and older get their flu vaccine, and that includes pregnant women. So everyone should get their flu vaccine. And then I wanted to share a winter preparation. So in preparation for trying to lower that winter peak, we put out COVID-19 winter peak preparations. So number one, we put get your flu shot. Again, everyone 6 months and older should get that. Number two, get your COVID-19 vaccine. Full protection is not attained until 2 weeks after your final dose. Number three, get vaccinated if you are pregnant or planning on getting pregnant. Number four, social distance from strangers. 5 is wear your mask properly in public, covering your nose and mouth. Cover your sneeze and cough. Also purchase a pulse oximeter to monitor oxygen levels if you do become sick. Wash your hands for at least 20 seconds and wash them often. Plan your holiday gatherings not now and start talking about having family and friends tested in advance of getting together. Plan to have smaller gatherings. Ventilate your home. Anytime you have anybody sick in your home, you should ventilate your home by opening a few windows. And now that we've had our first little front, it's a good time to air out your house. Purchase hand sanitizers and other household disinfectants. Take your vitamins, the vitamin C and D and zinc. Get 8 hours of sleep. Stay home from work and school if you're sick. Even if you think it's just allergies, it's better to stay home and be safe than to be sorry. Get tested. If you were exposed to somebody with COVID-19, get tested. Get daily exercise and fresh air. And finally, take care of yourselves and take care of your loved ones. So I will now turn it over to Gabby, who will do a Spanish translation, and then we will see Dr. Byrd on a video to go over the Coastal Bend statistics. Thank you.
El día de hoy se reportan 88 casos positivos por COVID. La tendencia en la última semana se ha ido para abajo, lo que son buenas noticias. El día de hoy son 3,302 casos activos, 59,823 personas se encuentran ya recuperadas. Se reportan hasta la fecha 1,149 fallecimientos desde el mes de marzo del año pasado. 228 personas se encuentran hospitalizadas, 84 de estas en cuidados intensivos. El día de hoy se reportan 9 fallecimientos en el condado de Nueces. Tan solo la última semana las muertes suman 41. Ya entramos al mes 19 de la pandemia y la cifra de muertos en los Estados Unidos por COVID ha superado la de la pandemia de gripe de 1918, lo que la convierte en la peor pandemia en la historia de nuestro país. Pronto comienza la temporada de resfriados y los hospitales pudieran experimentar un mayor flujo de pacientes. Le pido continuar tomando sus precauciones y protegiendo a su familia. El invierno pasado nuestro pico fue más de 5,000 casos. Este invierno nuestro objetivo es mantenerlo por debajo de los 1,000. Los casos pueden reducirse siguiendo algunas medidas no farmacéuticas, como el distanciamiento social, practicar buenas medidas de higiene, quedarse en casa si está enfermo y, por supuesto, vacunarse. Le recordamos que aunque esté vacunado, utilice su cubrebocas, especialmente si va a estar cerca de personas que no son de su hogar. Le pedimos que haga lo que sea posible por cuidar a su familia, sobre todo a sus hijos, y evitar el contagio del virus. Nuestros hijos menores de 12 años no tienen protección contra este virus, pero nos tienen a todos. Haremos todo lo que esté en nuestro alcance para mantenerlos a salvo. A partir del pasado día miércoles, el 59% de los tejanos de 12 años o más están completamente vacunados aquí en el condado de Nueces. Tenemos el 58% de esa población completamente vacunada y el 75% de las personas mayores de 65 años están completamente vacunadas. Esperamos ver un aumento en nuestro porcentaje de vacunados a medida que más niños sean elegibles para recibir la vacuna, probablemente de 5 a 11 años ya a finales de octubre. El viernes, la FDA votó a favor de las vacunas de refuerzo Pfizer para personas mayores de 65 años, así como para aquellas con alto riesgo de enfermedad grave. Es probable que las personas con alto riesgo de exposición en el trabajo, como los trabajadores de salud y los maestros, también sean elegibles para una dosis de refuerzo. Esta aprobación es solo para la vacuna Pfizer. Vamos a estar administrando la vacuna de refuerzo Pfizer una vez que sea aprobada y pudiera ser a finales de esta semana, pero le recordamos que solamente es para la vacuna Pfizer. Las pruebas positivas al COVID del 1 de julio al 20 de septiembre, 17,338 personas no fueron vacunadas y reportaron la presencia del COVID en su sistema. 812 personas también resultaron positivas, quienes ya estaban completamente vacunados. Mientras que los pacientes hospitalizados por COVID del 1 de agosto al 20 de septiembre, 799 no estaban vacunados y 99 casos fueron casos extraordinarios. La temporada de influenza comienza el 1 de octubre y se extenderá hasta mayo del 2022. La última temporada fue inusualmente baja en los Estados Unidos a pesar de altos niveles de pruebas. Las medidas para minorar los contagios por COVID, como el uso de cubrebocas, quedarse en casa y lavarse las manos, probablemente contribuyeron a la disminución de la incidencia, las hospitalizaciones y las muertes por influenza. Queremos alentar a la comunidad a que también salga y se vacune contra la influenza. Ahora el reporte del Dr. Chris Byrd.
Good evening. My name is Dr. Chris Byrd. I'm here to speak to you on behalf of the Texas A&M University Corpus Christi Informatics and Modeling team. This is your weekly COVID-19 pandemic report. We have two objectives on the modeling team. The first is to address your concerns and questions about COVID-19, and the second is to enable evidence-based decision-making on behalf of our local leaders. Let's get right into it. This week, it looks like the cases are continuing to decline. What you're seeing on the screen right now are the number of new cases per day broken down by age class. That's the color. 0 to 19-year-olds still have the largest number of cases, followed by 20 to 39-year-olds, then 40 to 59-year-olds, and then 60-plus-year-olds. If you compare these two panels to each other, the reason why they look so different is because here on the left, these are the unvaccinated cases. You can see there's many more unvaccinated cases than people that have been vaccinated with at least one dose or 2 doses on this side. So overall, the majority of cases are unvaccinated, and the cases are continuing to decline, so that is a promising sign. Now, I know a lot of people have asked me about reinfections. How many reinfections are occurring in people that are not vaccinated versus people that are vaccinated? And how would we even determine what is a reinfection and what's not? Well, the way that we do it is we query the database for people that occur multiple times, and then we measure the amount of time between positive tests. And if there's more than 90 days between positive tests, then that counts as a reinfection. In doing that to the data for Nueces County, we found that there were almost 200 cases of reinfections, and of those, well over 150 were not vaccinated, and under 20 were fully vaccinated. So the majority of the reinfections are unvaccinated. I also just want to put a little qualifier on this data. The total number is probably higher than this, but because people's names and phone numbers and information are typed into the database, there's errors, and sometimes people with the same person who tests positive twice won't come up in our matching system. So these numbers are an underestimate, but it's certainly a fair comparison between fully vaccinated and not vaccinated. And again, this is since July 1st, so this is just Delta wave. Moving forward with our model calibration, and what you really get out of this model calibration is the trend in the number of cases per week, and you can see that it's trending downwards. In black, we have the number of new cases per week, or per the last 7 days from each point, and in orange, we have the weekly modeled number of infections in the community total. They're scaled to each other, and this is how we calibrate the model. I decided not to recalibrate this week because we still have a decent fit to the data. So the cases have been declining for 2 weeks, and the projections we gave last week are the same projections that we're going to give this week. And we're going to model the 2 scenarios again. We're going to go with the present projection, which is going to be in blue, where the transmission rate presently is 0.7. And then we're going to ask the question, what would have happened without the vaccine? Because I think some people are wondering, well, did the vaccine do us any good, given that we've still gone through a major COVID spike, even though about half of our community has been vaccinated at this point? So are the vaccines really doing anything? And so the way that we are going to model this is I'm just going to adjust how many people in the coastal bend in the model are susceptible to COVID. People that have been vaccinated have a high probability of being protected from COVID or being immune to COVID. But people that have not been vaccinated and people that have only recovered or never been infected have a much higher probability of being susceptible to COVID. So that's how we run these 2 scenarios, and let's see how they look. Again, in red, we have what would have happened without the vaccine, assuming all the other dynamics about how we responded socially were the same. And we would see a 45% higher peak, which is up at 200 people in the ICU at the peak. Now, that's not what happened. That's what could have happened if people weren't vaccinated. Because people were vaccinated, we had about half the community vaccinated, the number of people in the ICU peaked at just under 150 and is trending downwards. And you can see that it's following our current projection here in the blue very well. and we hope that this will continue to go downwards. It's possible for this to drop down even faster. That would be if we do more to stop the transmission of COVID. It's also possible in the future for this to go out towards the red curve, or even go up if we relax and take off our masks. So everybody should keep their masks on as long as you do that. As long as your people haven't been vaccinated, continue to get vaccinated, and we social distance and do the things that we're doing to slow down the transmission rate. This should continue to come downwards. For the total number of inpatients in the coastal bend, we peaked at between 500 and 600 people in the hospital with COVID. This was a few weeks ago now. We're trending downwards pretty closely to the model projection, which is good. There would have been 45% more people in the hospital at the peak if there were no vaccinations. So again, the vaccine really did us a favor here. If we had gone this high with the number of people with COVID in the hospital, we probably would have ended up with people in tents and in parking garages. So it's very good that we didn't go through a peak that was that severe. Again, this should continue to come down. Now, just because the cases are coming down doesn't mean that we don't still have an issue with the amount of capacity in our hospitals right now. So presently, 28% of hospital capacity is dedicated to our COVID patients, and it's still a very high percentage. And it looks like it's coming down very fast, but when we were up at 40, now we're still at 28, even though we're coming down decently fast. This is still huge. It's still more than that 15% cutoff that used to trigger businesses rolling back capacity and allowing local leaders to make to take additional measures to stop the spread of COVID. So there's a lot of COVID that's still out there, and our hospitals are still under quite a bit of stress. And I think a better way to measure how much stress the hospitals are under is to look at what percentage of inpatient beds are staffed and empty. That means that they could take a patient. And right now we're at 3%. This is an extremely low number. You can see that I'm showing the numbers back through last summer, and we were never at this low of a percentage until this current Delta wave. It's a combination of having more COVID patients than in non-wave situations, along with having fewer staff. Those two things combined are leading to, over the past couple weeks, the lowest vacancy in our hospitals that we've seen throughout the whole pandemic. Lastly, with the fatalities, in the black dots, we have the actual number of fatalities counted up in the 7 days before each one of these dots. Now, the reason why we do weekly fatalities is it smooths out the data a lot. It makes it much more even. There's a lot of variation if we look at day-by-day fatalities. And what I want to focus you on is that we're up above the prediction here. And it does look like it's dropping off, and I do expect that, in actuality, the number of fatalities is obviously declining. However, this data comes from the state, and they're counting up the death certificates, and there's a substantial lag, from what I can tell, in them getting the full number of counts done. So while we do have data points here, they probably represent counts that are not complete yet. And each week, when I compare this to the previous week, points back here are still pushing higher. So I expect the peak of this black set of points to end up over here around September 3rd. We'll see how that plays out. It'll probably take a few more weeks for us to figure out if the fatalities actually dropped off more quickly than we thought they would, or if they went up and came down at the same proportions or at the same level that we thought we projected that they would. Here's where the vaccines made the biggest difference, by the way. Remember, this red line is if we did not have vaccines, we would have had approximately, in these estimations, 100% more fatalities at the peak than we're seeing right now. So the vaccines, especially because there's a disproportionate number of older people that got the vaccines, that's why there's a disproportionate effect on the number of fatalities that we avoided by having the vaccine and the vaccinations out there. So in summary, the vaccines work. 2, new cases, hospitalizations, and fatalities are declining, so that's a good thing. If we keep up our efforts to down the transmission of COVID. And that means people that aren't vaccinated get vaccinated. That means people that are wearing masks today wear them tomorrow. Will continue to decline at the rate that you see in the projections. If people that are not masking up today mask up tomorrow, it'll decline faster. But if we let off and people start taking off their masks, the decline will slow down. And we're not at the point yet where we want to do that. We want to get COVID lower so that it can't rebound nearly as quickly. The fatalities are still being counted by state. So remember, those figures on fatalities, including those black dots, are going to change. Okay, recommendations to flatten this delta wave and keep it narrow and don't let it, protract out. If you're symptomatic, self-isolate, get tested. If you test positive, go get the monoclonal antibodies. Remember, this is the presidential treatment. President Trump got these monoclonal antibodies. I also want to point out that all the presidents that are alive and former presidents of the United States of America have gotten the vaccine. But anyway, these monoclonal antibodies, they're free. They're free for people here in the Coastal Bend in Nueces County. There's 2 places you can go. Your doctor can give you a referral. But remember, as soon as you test positive, you want to get that referral and go get them, because these monoclonal antibodies, they keep you out of the hospital. They're meant to be taken before you get to the hospital. If you're at the point where you need hospitalization, you won't be eligible for these monoclonal antibodies anymore. So beyond that, make sure that you continue to mask up in public and social distance. I would say there's a lot of COVID out there, even outside in crowded situations. You should probably wear a mask. If you're inside, certainly in crowded situations, masking up will help to reduce the transmission of COVID. And finally, get vaccinated. It's important for us to get vaccinated. They have a big effect on how stressed out our healthcare system gets. And it's not just about the healthcare system, it's about us, Coastal Benders. Are we getting the healthcare that we deserve? And when COVID's so high, we're not. And what we want to do is get those COVID levels down so that we can get the hospital care that we all deserve in the Coastal Bend. Lastly, I want to talk about travel tips. This week I'm not there because I'm traveling. And I want to point out some of the things that I realized while I was traveling. First, you really have to mask up when you're in the airport or on any sort of public transportation, regardless of what it's like where you are. When you travel somewhere else, these rules are being enforced pretty strictly. So another thing is you can get tested, especially if you're unvaccinated. If you're unvaccinated, the CDC recommends that you get tested before you travel. Now, I got tested because I'm visiting people that may be susceptible to the effects of COVID, even though they're vaccinated. So I got tested at the airport after I landed to make sure, or to see if I have COVID. I'll get the result in about 24 hours, and it's at least some peace of mind. 2, make sure you wear your mask, obviously. 3, depending on where you go, they might actually use those vaccination cards that you got, so make sure you bring them. I know me, I kind of lost them for a little bit, but I had to dig them up, and mainly because I saw a story where a restaurant, and I think it's a law in New York City right now, where restaurants are requiring that for you to get service that you have a vaccination card, at least to get sit-down service. Lastly, self-monitor while you're traveling. Keep track of your own symptoms. Are you starting to cough? Are you starting to sneeze? If so, you may want to get tested or refer to the previous set of summary points. So that's it for this week. That's our report. You can tune in next week and we'll have updates, and I'll be sure to bring you a new view of the pandemic with new statistics and how people with vaccinations versus without vaccinations are performing. So we'll see you next week.
La mayoría de los casos registrados en el área de la costa son de personas que no están vacunadas, pero los casos están declinando. Los casos por reinfecciones en el área de la costa han sido de pacientes que no se han vacunado después de haber contraído el virus. En las últimas 2 semanas, los casos positivos en nuestra área han declinado y continúan aminorando. De acuerdo a los pronósticos, sin la utilización de la vacuna, se estima que los casos aumentarían hasta un 45%. El porcentaje de los pacientes con COVID en los hospitales es del 28% y continúa declinando, aunque las camas disponibles en los hospitales aún es baja, de tan solo el 3%. Resumiendo, las vacunas son efectivas. Los casos nuevos de hospitalizaciones, así como fallecimientos, continúan declinando. El número de fatalidades está aún siendo contabilizado y está atrasado por alrededor de 2 semanas, por lo que esa cifra va a cambiar. Las recomendaciones para evitar contagios, así como la propagación del virus: si cuenta con síntomas, aíslese, tómese la prueba de detección. Si es positivo, obtenga un tratamiento monoclonal de anticuerpos. Los tratamientos son gratuitos y existen 2 lugares donde puede obtener estos tratamientos, aquí en la ciudad de Corpus Christi y en la ciudad de Robstown. Utilice su cubrebocas, no importando su estatus con la vacuna. Practique distanciamiento social y, sobre todo, vacúnese.
Thank you, Gabby. Are there any questions? No questions, and so that concludes our COVID-19 update. Thank you so much for being with us. I just want to remind individuals that we may not be here next week. It depends. We're looking at the cases and seeing how everything is going. So just pay attention to the media and you'll get those updates. But thank you for joining us today. We really appreciate it, and we hope everyone stays safe. Thank you.